Western Herbal Medicine. This presentation centers around Western herbal medicine. In this presentation, we will be educating you on the definition, the history, teaching methods, advantages and disadvantages, misconceptions and misuse, plan for intervention, and plan for evaluation. So please sit back and enjoy the presentation. What is Western herbal medicine? Western herbal medicine is used as a clinical practice of healing, which uses a natural way with little or no industrial materials or processing. It uses the plant material and the plants themselves to create medicines to help prevent and treat various illnesses and diseases. Some or all of the plant may be used in the preparation of the medicine, but usually it's the flower, roots, fruits, leaves, and bark that seem to be the main ingredients in creating medications for treatments. Western herbal medicine is one of the oldest forms of healing known.
Let food be thy medicine, let medicine be thy food. A quote from the historical physician Hippocrates, who also used traditional herbal medicine in his own personal practices. Western herbal medicine is one of the oldest and now one of the most widespread types of alternative medicine used today. It was originally looked at as being superstitious and frowned upon. Nicholas Culpeper was an English botanist, herbalist, physician, and astrologer. In the 17th century, he created the English physician book that centered on how to make herbal remedies. A physician by the name of Hildegard used herbal medicine also. She forced women and midwives to do the same. In the 20th century, the arrival of antibiotics pushed herbal medicine to the back seat. Today, alternative medicine, especially Western herbal medicines, are accepted and used by professional practitioners and licensed herbalists everywhere. When teaching your patient about Western herbal medicine, there are a few tips that you need to consider. You must always do your research. This means using textbooks, articles, databases, and easy to use guides that will help the patient understand the efficacy, contraindications, side effects, drug interactions, and pregnancy classifications about certain Western herbs. There are patient focused resources that are informative to explain what Western herbs and medicine can provide a patient easily. Herbal supplements are regulated by the FDA, but they aren't regulated the same as foods or drugs. They fall under a category called dietary supplements. The rules for dietary supplements are a bit different. The regulation guidelines for herbal supplements meet the manufacturing standards, but they do not guarantee that they're safe or effective. So when using them or buying them, do your homework before. Know your patient. Be versed in your patient's individual health profile. Know your patient's medication history because herbs can inhibit them and possibly have a potential drug interaction. Make sure you know of any illnesses that your patient may have, such as diabetes, any autoimmune diseases, cardiovascular diseases, liver damage, before you prescribe any herbal medicine treatment. Patients should be informed that taking one herb at a time will help in pinpointing if there's any allergic reactions to any of the medications or any interactions between the drugs that they're taking and the herbs that they're taking also. Collaboration. When teaching a patient about herbal medicine, make sure you inform them to seek assistance from a health professional, a general practitioner, or a professional herbalist so that they can get the full information of what they're taking. Make sure if you are prescribing or treating the patient, you give a referral list of and recommendation of professionals for the patient. Use this opportunity to motivate your patient. Patients that are active in promoting health are usually the best candidates for using this quality of herbal treatment. If the patient wants to move forward with this type of treatment because they are curious to explore other options, be there to support. Make the patient aware that safety is always priority, but do so in a respectful manner.
Advantages of Western herbal medicine. Many people believe that Western herbal medicine is definitely affordable to the average person, more than over the counter medications and especially prescribed medications. Many people believe that this type of medication and treatment is easier to come by rather than other specialized or expensive treatments that may not even be available. This is important because many patients want a treatment that works and that is easier to get access to. These types of treatments do not require a prescription, but rather just an expertise from a licensed practitioner or a licensed herbalist in this field. These types of medications are easier available to patients to help in improving their overall health naturally rather than taking medications that cause side effects or can be costly to a patient. Having the natural healing is a treatment that healthcare professionals as well as patients feel that would be the ultimate goal in achieving a healthy lifestyle. Disadvantages of Western herbal medicine. Western herbal medicine cannot be effective against serious ailments and disease. This includes broken bones, stroke, and even heart attack. Some patients may switch to herbal medications, which may cause additional symptoms or side effects that will hinder their health even more. This is because non prescription medications are not monitored as effectively, which can affect the patient's overall outcome that may be more harmful than beneficial to them. Some patients may experience allergic reactions to herbal medication, not actually knowing which specific herb that was consumed is causing the allergic reaction. This can also be true with prescribed medication, but since these medications are taken by prescription, the chances of a reaction are less. It is not always clear on the way a herbal plant was prepared, and this may lead to the chemical toxins reacting in a poisonous response to a patient. Lastly, Western herbal medications are usually self administered. The dosage, ingredients, and warnings about how to administer the medication is not clearly stated. This, in turn, can cause negative responses in how the medication and or treatment can affect the well being of a patient. Misconceptions of Western herbal medicine. Many people believe that herbal medications are not as effective as taking over the counter medications or prescribed medications. This may be due to the practitioner not being educated or knowledgeable in these types of medications and or treatments themselves. Western herbal medicine is said to be 100% effective because they are natural and a product of natural healing. There are safety concerns regarding the preparation, chemical toxins, and the actual dosage and ingredients that can make them harmful to a patient. Western herbs are said to sometimes have the same advantages that other medications provide for therapeutic use, but it is not determined whether this is accurate or not. There is no scientific support or research that is clear that herbal medication is as effective as prescribed medications or over the counter medications. It is starting to become more clear that these types of treatments are becoming more widespread and beneficial. This is why we need to have the guide of a licensed professional. These individuals specialize in the research and knowledge that has helped them to become an educated and respected licensed professional in the herbal medicine today. Misuse of Western herbal medicine. The safety of the herbal medicine with other prescribed medications can cause drug interactions, complication, and harm to a patient if not under the care of a licensed professional. Not knowing the side effects that may arise with the individual patient and the herbal medicine treatment is putting a patient at risk. And not knowing the exact preparation of herbal plants and how the chemicals could be toxic to a patient is usually something encountered with an uneducated or non licensed practitioner. This can cause severe drug interactions and even possible death to a patient. Knowing the medication's exact dosage and ingredients is important for the patient and needs to be determined by a certified professional with education in herbal medicine. If a patient doesn't believe that the professional is not educated properly and lacks confidence in the herbal treatment plan, then a patient should not have the confidence in that professional and go elsewhere. Being secure with the confidence and knowledge from a licensed professional is always the best and safest treatment that a patient can always encounter. Cultural competency goal. Cultural competency is needed in providing patients with care to value their beliefs and behaviors. This will ultimately improve the patient's outcome to the treatment, enhance respect from patients, and increase the help and participation from the patients themselves. You want to make sure that you understand the different communication styles, beliefs, attitudes, and behaviors that relates to the culture of your patient. This will enhance confidence between you and the patient, and hopefully this course of treatment will be beneficial to the patient. Understanding cultural competency and how all cultures perceive healthcare and treatments differently is important in determining what treatment options to present the patients. All cultures have different beliefs about treatment and how it affects them and their families. This can sometimes be a family decision that is brought to the attention of a licensed practitioner or a licensed herbalist. The main point of knowing and educating yourself on cultural knowledge and competency will show the patient and their families how the professional respects their cultural beliefs and their cultural values today. Plan for intervention. You want to always make sure that the information you gather for the patient is always reliable and researched thoroughly. This is important because it shows how the professional cares about the well being, values, beliefs, and behaviors that will increase the improvement of your patient. You want to always be confident in what you say and knowledgeable about any questions that may arise. If you don't have an answer, make sure that you take the time to find out before patients begin any type of treatment. Patients should always be under the care of a general practitioner or a licensed herbalist. This is extremely important for all patients, but most definitely important for those patients who are taking over the counter medications or that are taking prescribed medications. This will help with any complications or interactions between the treatment and the medications themselves. Some examples of Western herbs are echinacea, which is used for the common cold, wounds, burns, upset stomach; ginger, which is used for migraines, high blood pressure, nausea, which is good for women that are pregnant; chamomile, which is for urinary tract infections, upper respiratory infections, stomach pain, and nausea; St. John's wort, which is used for insomnia, depression, kidney and lung disease; ginkgo, which is used for heart disease, dementia, and mental difficulties; elderberry, which is used for headaches, nerve pain, and or viral infections; turmeric, which is used for inflammation, pain, and anxiety; and ginseng, which is used for brain function and to boost immunity. Plan for evaluation. It is always necessary to schedule a follow-up appointment for a patient to go over any side effects, complications, drug interactions, and even effectiveness the herbal treatment is providing the patient. You want to check up on the patient within 1 to 2 days after the visit and after the treatment begins to see if they are having any sort of drug interaction or complications with their other medicines or the treatment itself. You want to always evaluate the effectiveness of the treatment at each visit to see how well the patient is reacting to the treatment from beginning to end. Most cultures now use some sort of alternative medicine in their life. And after much research, it seems that Western herbal medicine is increasing throughout each and every culture. Western herbal medicine treats the body like a natural healing power. And in researching how herbal medicine is becoming more popular, it seems that individuals are now leaning towards natural treatment versus prescribed medications. In conclusion, I hope you enjoyed the presentation and hopefully gained some knowledge into Western herbal medicine and how it is becoming widespread today in our culture as well as other cultures.